Hey, Dr. Lindsey and Wendy here. This is a little update on a guy we worked on about 3 years ago. And he had 3 surgeries elsewhere? 4 surgeries elsewhere, yes. And came in with the usual mistakes or the usual problems. Big wide scar, sparse hairline, and a little bit of hair sprinkled all over his head.
All over his head, yeah.
So we did 2 cases on him. We cut out his scar initially several years ago and got him around 1,900 grafts, which we trimmed his front and packed it in. And then 3 years ago, we did a modified FUE because he's got a doggone tight head. And we got, I think, 1,377 grafts, which we put also in his front third. And he popped in out of the blue last Friday with a new girlfriend and wanting a little bit more hair if we could get it. And sure enough, we're going to get him to do some scalp stretching exercises. And I think we can do probably a combination of a small strip and some modified FUEs on the side and get him another 1,000 or so grafts, which he wants to add behind his current work. But here's a little interview with this fella, and this is him at 3 years after our second case, and he'd had 3 cases before he got to us. So take a peek. Steve, you came in here from another doctor. I'll put the pictures up, and we did some hair in the front. Wendy, are you here to come?
Yeah.
And that's about 5 years ago.
That was first time. Second time was 3 years ago.
And that looks pretty good. And you're half Asian, right? You're not fully.
Well, I got my DNA. My mom passed away last year, so I did a DNA. She was wrong.
What are you?
So what are you?
I thought I was 50% Korean, 50% Italian. But no, I might be related to you. It came back 30% British, Irish. The next is a French, German, Norwegian, Scandinavian. Then I'm only 30% Korean.
Well, maybe
I have 11% Japanese, and then 6, 7, 8% whatever, somewhere in Asia.
What a mix
you look
you
good.
are.
You're like my second cousin. All right, turn around and face the wall, Steve. All right, chin up a little higher for me, please. So show his scars from the other guy.
Right here.
Oh, the side one is bad. If you do the side, the scar is the worst.
All right, that's good. And then go up and show our little scar.
Where is it?
Right there.
Right there.
All right, so that's good. Now chin up a little higher for me, please. Now, I told you before that the crown's a damn black hole, so we put a bunch of hair in there.
This is where we start.
And it looks good, but it stops here, so maybe we can put a little bit more down through here. And
do I have enough to do one more?
Yeah.
Okay.
Yeah. All right. So, what do you think about him?
Well, I have a question for you. So, I see every day, and I have questions all the time, when you do a consultation and you say, part 1, part 2, crown never.
Right.
So, with this guy, okay, he is going on his 5th hair transplant.
But he did 3 of them without thinking right.
Exactly. Well, 3 with somebody else, right?
Right.
2 with us.
So he's going on at 6 now.
And going on at 6. So, I remember that we put a little bit, because he had already sprinkled all over.
Yeah.
Okay?
But when you got to fix some other problem, I mean, you're kind of constrained by what they got, and what the customer wants.
Okay, I understand that. But some patients, which they call, said, oh, all I got is 2 hair transplants in me. So when they see something that somebody's getting a 6th one.
Right. So in general, I think that most people have 2 big strip cases in them. Sometimes it's only medium strip cases because of their density, and sometimes it's 2 really big strip cases. But with 2 strip cases, typically, you can get from where my sparse hairline is to right about there. And then your second case, you can get to about here and add a little bit to the hairline. But then you're probably use the bulk of your donor hair. You still have hair back here, but if you start trying to whittle that away, then you might end up with not enough in the donor area and look funny. And it may not be enough to cover the crown. So my way of being safe is to tell people they get 2 and then never. And then if it turns out that we've got some left over and they want to do it and it's a manageable problem, I'm all for doing it.
Okay, so that's what I want to do. Because a lot, like I said, a lot of them think that 1, 2, and that's it. and then that's all, because that's all they hear. And I understand why is 1, 2, because they will not want to end up with this guy's
Sprinkled
the
all over,
back
like a
of the
chia pet.
head, with the back of the head with white scars and different other issues. But some people might have more than 1, 2, and a little bit depending on their density.
Yeah.
Okay.
So, just Wendy and I banter back and forth. If you have questions or we can help you, please give us a call. Thanks.